212 is on the posterior midline, below the spinous process of T3. Do14 is on the posterior midline, below the spinous process of C7 in a depression. Bladder 11 is 1.5 cm lateral to the posterior midline, below the spinous process of T1. Going to find the inferior border of T1 and come directly lateral to it on the height of the paraspinal muscle.
Small intestine 14 is located 3 cm lateral to the inferior border of T1. Locate your T1, move 3 cm laterally. The 3 cm at this level is dictated by the medial border of the scapula. Small intestine 15 is located 2 cm lateral to the inferior border of C7. Locate your C7, use the medial border of the spine of scapula to dictate your 3 cm mark, move out 2 cm to find this point. Gall Bladder 21 is located midway between Do14 at the base of C7 and the lateral extremity of the acromion process, but at the crest of the trapezius muscle. To find the crest of the muscle, it may be necessary to dip down slightly to make sure you get the highest part. This point forms a line with Sanjar 15 and small intestine 13. Gall Bladder 21.
Pericardium One is 1 cm lateral and slightly superior to the centre of the nipple, in the 4th intercostal space. The root of the breast typically lies in the 5th intercostal space, palpating up 1 intercostal space so that I'm in the 4th, for Pericardium One. Ren 5 is on the lower abdomen on the midline, 3 cm superior to symphysis pubis. Ren 7 is on the midline on the lower abdomen, 4 cm superior to symphysis pubis. Ren 12 is 4 cm superior to the centre of the umbilicus on the midline. Ren 13 is 5 cm superior to the centre of the umbilicus on the midline. Ren 15 is 7 cm superior to the centre of the umbilicus on the midline. Kidney 17 is 0.5 cm lateral to the midline, 2 cm superior to the centre of the umbilicus at the level of Ren 10. Spleen 12 is on the lower abdomen, level with Ren 2, 3.5 cm lateral to the midline, lateral to the femoral artery. Gall Bladder 24 is 4 cm lateral to the midline in the 7th intercostal space. When you palpate this point, make sure that you are in the intercostal space, not on the rib. Ren 22 is on the anterior midline in the suprasternal fossa, 5 fen superior to the suprasternal notch.
Do16 is located on the posterior midline at the base of the occiput. To find the base of the occiput, palpate down to about 1 cm superior to the posterior hairline. If you rock the head backwards and forwards very gently, you should be able to feel the cleft between the base of the occiput and the spine. Make sure you mark this point directly on the posterior midline. Bladder 10 is located 1.3 cm lateral to Do15. It's 4.5 cm from Do15 to the mastoid process. So divide this area into 3 and just come a little closer to the posterior midline. You'll be on the lateral edge of the trapezius muscle. Bladder 4 is located half a cm into the anterior hairline, 1/3 of the distance from Do24 to stomach 8. Bladder 4. Gall Bladder 3 is located directly above stomach 7. Palpate over the zygomatic arch and feel for a nice dip just above its superior border. To locate gallbladder 20, palpate up the groove in between the sternocleidomastoid and trapezius muscles. As you get to the base of the occiput, you will find a nice depression. Gallbladder 20 is in the centre of that depression.
Large intestine 4, you're going to find the length of the second metacarpal bone. So running your finger down, finding the base, making sure that you're not actually on the carpal bones themselves, finding the midpoint of that shaft of bone, coming between the first and second metacarpals, nearer to the second than the first in the muscle.
Large intestine 10 is located 10 cm proximal to large intestine 5 on a line heading towards large intestine 11. Palpate along that line and fall into a nice groove in the muscle at 10 cm.
Pericardium 6 is on the flexor aspect of the forearm. It's 2 cm proximal from pericardium 7 and it's in between the two tendons palmaris longus and flexor carpi radialis.
Spleen 4 is located in a depression which is distal and inferior to the flare of the base of the first metatarsal. Feel along the inferior border of the first metatarsal, find the flare of the base and place your point in between that flare and muscle. Spleen 4 is about 1 cm proximal to spleen 3. Be careful when palpating along the inferior border of the metatarsal that you don't overshoot the head and find this nice dip in between the medial cuneiform bone and the base of the metatarsal. It's a nice dip, but it's not spleen 4. Spleen 6 is located 3 cm superior to the medial malleolus, half a finger breadth posterior to the medial crest of the tibia. Be sure not to place this point actually on the bone. Stomach 36 is located approximately 13 cm superior to the prominence of the lateral malleolus on the anterior border of tibialis anterior. The easiest way to find it is to palpate down the tibial tuberosity. Find the base of the tibial tuberosity and move slightly laterally until you fall into a nice dip on the anterior border of tibialis anterior. This point is also 3 cm inferior to the inferior border of the patella. Stomach 44 is located half a cm proximal to the web margin between the second and third toes. This point should fit nicely into the flare of the base of the proximal phalange of the second toe.